All right. So it should be live now. I'm just going to check Instagram.
Sure.
So, yeah, it's good.
Yeah, it just said starting a live video.
Perfect. Okay, so we're live on LinkedIn, Facebook, YouTube, Twitter, and Twitch, and now Instagram. Awesome. All right. Okay. So, hey guys, welcome to the CPD Junkie podcast, where we bring you interviews with dentists sharing their CPD stories and journeys from around Australia. What better way to learn than to follow those who've already done it before? CPD Junkie is Australia's most comprehensive CPD. So head over to cpdjunkie.com.au and become a member for free to access the full features of the site. I'm your host, Laurence Doan, and tonight we are joined by Dean Licenblat. Dr. Dean Licenblat has been in private practice in Sydney, Australia, since graduating from the University of Sydney's dental program. He went on to complete a master's degree in oral implantology and bone grafting from Goethe University in Frankfurt. He now holds a teaching appointment at Goethe, where he is responsible for tutoring the university's graduate students in Australia and New Zealand. His special interest is bone grafting, where he applies innovative solutions to complex problems and is always up to date on the latest concepts and technologies. As a member of numerous dental societies and unparalleled dedication to continuing education, he often attends postgraduate educational programs both locally and abroad. Dean Licenblat, welcome to the show.
Thank you very much for having me. I appreciate it.
So you preach knowledge and continuing education is key. Tell us about your CPD journey so far.
Well, you know, when I first graduated Sydney Uni, I just went straight into private practice. So the first thing I did was, in order to actually get the job, I had to do the CEREC course. So the CEREC course was the first course that I did. So in order to land that job, and then straight away, I think in the same weekend, I did Invisalign and rotary endo. I did them both in the same week or same weekend, whatever it was. And that's pretty much where I started. And I did a lot of general practice from there on in. You know, at uni, I placed my first implant. I was one of the first guys to put an implant in Sydney Uni's dentistry program. I think the undergrad B-Dent program, as it was then, myself and one other. And I really, really enjoyed it. And that's where I knew I wanted to take my career. So as soon as I got out, I think at the end of my, I guess 2007, when I first graduated, within the first few months, I started my first program in implantology, and I went and did an MIS weekend warrior course. And then from there, it all kind of started from there.
Wow. Okay. Yep. Sorry.
Sorry, I got into a practice that was big into ortho, although I never did it. I was never really interested in it. But then the principal kind of went down this TMD occlusion pathway, and I followed him. And look, I had a really, really good learning experience. I spent a lot of money at LVI and Olmos and did all those things. You know, it was well over 100K. And at the end of it, you know, I had some awakenings, and I had some, you know, some great knowledge and things that I applied a little bit today, but a lot of it I've kind of left behind. And now I've just gone with my implantology stuff and just run with that.
Right. So we've got a guest question by Dr. Vishish P. He wants to know your journey at the Goethe implant program, you know, the goods and the bads and what you wish you had known.
Oh, well, that's a really good question. Look, Goethe's program, if you're looking for a cookbook, it's not the right program for you. It is a Master of Science. You do need to come pretty well prepared. So if you're going to go there hoping to learn implants, it's the wrong program. In fact, that program works best. The more you know, the better it is, because that program is really just going to give you some gems and some pearls. And the more you know, the more you're actually going to get the juice out of those small little pearls that you're going to get. What I wish I'd known more was, I wish I knew more about soft tissue. So when I first graduated and when I first got into implantology, it was all about implants and bone. And no one really cared too much about soft tissue. And the pendulum's kind of swung the other way now, where everyone's getting all excited over soft tissue and stuff, and that's cool. But that wasn't my jam back when I first started implants. So it's something I'm having to go back, and that's something I really wished I would have learned a lot more about before I went to Goethe, because there was a big focus on that.
Right. And how'd you come across that? Because obviously, did you come across it from someone recommending it or?
Yeah, I did. It came across, I was using a lot of ankylosing implants at the time. And the guy that runs the program or was running the program at the time was the inventor of ankylosing. And they said, well, you're doing some implants. Why don't you, have you considered doing this? And I went, that's a great idea. And I signed up.
Right. And so would you recommend it for someone who hasn't had a lot of implant background, or no, you should do something with, yeah.
Look, I think there's some people that are pretty smart, well gifted, and maybe after placing 30 or 50 implants, they can go ahead and do a program like that. But to get the most out of it, you really need to know what you're doing. You need to be very confident doing sinus lifts and block grafts and stuff like that, soft tissue procedures, then go off and do it. If you, we have people that were learning what abutments were. If you're at that level, it's not the right program because you're going to miss 90% of what they're trying to teach you. So it's good if you want to waste your money and just get a few letters after your name. Fair
enough. So let's just hash back with some of the things that you mentioned early on when you're starting out. You because of the practice, you were doing CEREC, you're doing Invisalign, you're doing rotary. That was based off because that's what the practice had set up. Is that right?
Yeah, the practice was very, very CEREC driven.
Yeah.
And the principal liked the ROI from the CEREC. Yeah. So everything, as much as possible had to be CEREC. And he said, if you want a position in this practice, you're going to have to go off and learn CEREC on your own back. So that's what I did. And you know what? I was very glad that I did. That I learned a hell of a lot from my first job in that practice in Sydney South.
As a graduate at the time, it sounds like you were spending a lot of money on CPD. For lots of young graduates, they think, I don't have that kind of income yet. Like, it's difficult to kind of invest in all of this. Do I wait a little bit longer, or do I just dive head, straight in and then worry about that later? I'm
always this person that always feels like time's getting away from me. So it's always now. I don't put off what I can do today. I just do it. I just get it done. And sometimes that works against me in that I jump into things a little bit too early and then maybe I don't get the maximum benefit from it. So it's a double-edged sword, I guess. And I think the right time is when you're ready to do it.
Fair enough. So after the implants program, where'd you try to continue upskilling from there?
You know what? When I went to Goethe, you meet a lot of interesting people. You start talking to people. You find what you really like, and you find where there's holes in your skill base. And I thought, as part of the program, we did. It was a great time of 2 or 3 days with Otto Zuhr and Marcus Hertzler, and that really opened my eyes into this whole soft tissue thing. And I thought, wow, that's really cool. But back in the day, that was really only for periodontists. When I first graduated, no one was doing full arch, restorative work at all. That was prosthodontist work, right? No one was doing apicectomies or molar retreats because that was endo's work. It was very, very specialist driven. But I'm seeing that again, that pendulum is swinging the other way now, where a lot of dentists, I see guys that have been graduated 2 or 3 years that are doing full arch preps and restoring full arches now. The things that they're doing now is just, we would never think of doing this. It's just crazy to us. So for me, I think that there was a lot of holes in my education, and that's where I sought to fill those holes.
Yeah. I guess moving forward, tons of people are probably going to hear this kind of information and go down that similar path and hopefully not make the same, not mistakes, but like following that kind of path.
There's no mistake in doing education. A lot of people could say, you spent more than $100,000 going to LVI and it's something that you don't do anymore. What, don't you think that's a big waste? My answer to that is no education's a big waste. There's still things that I take away from that and things that I do implement into general practice. So I don't think it's wasted, but the sooner you can find what you really love and where your passion lies, the better you're off you're going to be and the less money you'll end up spending. But to caveat that, I think there's a lot of people that want to get into implants or want to get into cosmetics, or they want to get into something because they see somebody else doing it and they feel like there's fear of missing out, or they want to be just like that person. And my biggest advice is run your own race, stay in your own lane, and just worry about what's right for you and what's good for you. Don't worry about what he's doing or she's doing or what level they're at or whatever. Just focus on yourself.
Yeah. You mentioned LVI, and I was going to ask you a question about occlusion is something that I've heard someone, for someone who doesn't place implants yet, but is doing the restorative side of things, what's something important about occlusion that the restorative dentist needs to consider?
Well, you know what? I did a lot of LVI and I was still bewildered by occlusion. It wasn't until I had a lecture from a prosthodontist called Jack Piamati, who's an orthologist, that the penny dropped. And it's when I started to really look at the occlusion of my implants and my implant restorative work. So I think that, whilst a lot of people want to get in there and start putting the bolts in, you do need to peel that back. And, I think a great place to start would be Tom Giblin's occlusion course. As a young graduate, I think you cannot get a better occlusion course than that, personally. I think it's a great place to start.
Yeah, I mean, especially, international borders are probably not going to be opening anytime soon. And right. Tim Giblin's in Australia, so that's definitely a great opportunity. There's a lot of literature that supports, one view, and then there's a lot of literature that supports another view for anything that we kind of do. So for dentists that can be kind of overwhelmingly confusing, especially when they attend one implant CPD after another. What's your advice on that approach?
My advice is find someone that you're happy to talk to, find someone that is happy to give you their time without any strings attached. There are a lot of mentors that are happy to do it for a fee or happy to do it for ego or whatever. Push all that aside. Find a mentor that is happy to give you their time, happy to teach you, happy to tutor you, doesn't feel threatened by you, and then just go and learn with them. And then from there, you will learn some solid basics and you can spread your wings from there. You will then find what sits right with you and what doesn't, right? The same as anything.
Another question I have is learning about things kind of hands-on, that feel tactile versus learning something through, theory. What's your thoughts on that? Can I learn everything through one way or the other?
Oh, look, I'm a big hands-on person. I'm one of these guys that I can, there are some people that can sit in a lecture room and just absorb all those slides into their head and they've just got it. I'm a hands-on person. I'm one of these, I'm a mechanic, right? That's how I got to do it with my hands. You have to watch me do it. Am I doing it right? Okay, good. Then practice that over and over. That's me. So because of that, we implement that into my courses where, yes, I give you the theory, but there's a lot of hands-on with models and there's also live patient hands-on because I think that's the way that worked well for me. And I want to impart that knowledge onto other people.
I think a lot of dentists tend to have a tendency to be more hands-on than theory, but yeah, it's good.
It's like if you're an audio person or a visual person. Some people can listen to a podcast and absorb all that information. Other people need to sit there and watch something and see little videos and diagrams. I'm the latter.
I'm with you on that one. So of all those CPDs, I think you've kind of mentioned it, what's had the biggest clinical impact on your dentistry today?
Oh, the biggest impact for me. Look, I really loved going to Goethe. And I went with my best friend. So for me, it was, I really, really had a great time, both in the class and outside the class. That had a big impact. And for me, it really, if I would have just continued on, I would have had a pretty good implant career just doing what I was doing. But once I got to Goethe, I saw what was out there. I saw a whole lot of different ways of approaching things, different people. And then you speak to, and that's like different clinicians that were running their own courses, and you go to their course and you speak to somebody else and he goes, oh, you think this is good, you should see this. And you go over there and you see this guy and you meet somebody else and he goes, oh, if you think this is good, you should check out that. And it steamrolls from there.
Yeah. And then that's how you came across all the other ones that you mentioned.
Yeah, a lot of those ones came from that. And to be honest, I get a lot of inspiration, believe it or not, from some of the friends that I have on Instagram. Right? There's a lot of guys, a lot of periodontists from the United States and oral maxers, and I look at their work and I chat to them privately, and there's a lot of knowledge there, and I get a lot of inspiration from those guys. and you just see what clicks with you and who resonates with you, and so on and so forth. And you'll just kind of follow that person's work, and they'll go, you know what, I did this course, or I met this person, or they do a technique, and you just ask them about it. And then they'll go, well, I learned it here, or this is what you need to do.
Would there be any CPD that you'd said that, you didn't quite implement or wasn't as beneficial for you at the time, but you would do differently next time?
Yeah, look, I did a number of composite veneer courses, and today I've never done one. I would sooner punt that away to somebody that's way better at it than I am. I'd punt that to Johan or somebody. I'm not good enough to do that. I have not got the aesthetic eye to be able to sit there and match all those composites. If someone wants my cases, just DM me, because I'm happy to punt them away. Just not interested in even porcelain veneers. I don't like doing them. I have no interest in doing them. I'm happy to punt them all away. Just that sort of stuff really doesn't float my boat. I constantly feel that there's somebody else that can do it better. So I'd rather just focus on what I think that I'm not bad at.
Yeah. So we know there's a growing trend towards things that are more metal-free, more holistic alternatives to titanium. And with zirconia implants, on the rise, for graduates who see this, what's your take in them trying to get into that quickly?
Beware. Okay, I do a lot of zirconia implants. I do a lot of them. The biggest thing is the patients, handling the patients. A lot of the patients that come for them, some of them are absolutely lovely and they just don't want anything metal, and that's cool. And you get some people that are just really out there and they make your life difficult. And it's that patient management that's the hardest thing. People think that a zirconia implant can be treated the same as a titanium implant. That's not true. There are little subtleties in working with those zirconia implants that can become a problem. And they're not the be all and end all. That's the one thing. There are a lot of people that, for instance, with the whole all on four thing, a lot of guys will, all on four is the answer for everything, but zirconia implants is not the answer for everything.
So I guess for new grads, beware.
New grads, you know what? Once you've done 100, 200 implants, think about it. Sometimes it's not worth the heartache or the stomach lining, to be honest. A lot of those patients, they will put you through the ringer. They will come for a free consult and take up an hour and a half of your time, no problem. And then they'll write you another email that's like 4 pages long. Right? You got to be prepared for that.
I guess people have to plan for the end in mind, hey?
Right. Look, if you're capable of answering all those questions and you want to answer those questions and you want to talk about meridians and all that sort of stuff, then sure, then take that on as a part of your armamentarium. If not, send them away.
So I kind of grazed over it, but we'll come back to this point about, you joined Instagram fairly late, would you say?
Yeah, I was a late bloomer. I think it's been not even 2 years.
But since then, it's, I'm going to ask you, who's been your biggest mentors, idols, or inspirations? And not just in Instagram, but in general, and why?
Instagram, look, I really like Implants DC. I think he is just solid constantly. I really like Phil Walton. I like The Gum Show, which is Abbas Hassan Ali. I like Dimitri. I like Fatty. I can just go on and on and on and on. Jess Lou. I like all those guys. They all, they generally seem to be periodontists, if I'm honest, most of them. But Sonata is probably my all-time fave. I've got a man crush on Dr. Sonata. But, I think the work that he does, he's not, so out and about with it. He's, if you actually go and look at some of the stuff that he does, he treats a lot of cancer patients. And I think that's really, he's got a genuine purpose and it's not so ego-driven as much as it is for the people. And I really like that. It's more than just, a little bit of soft tissue and a pretty picture.
Fair enough. So I guess they've been great inspirations because of the reasons why they do it, less so.
And sometimes it's the reasons and sometimes it's the skill level. Some of their skill level is just the results they want is perfection. They aim for perfection and a lot of the time they hit it And that's kind of the same sort of level that I would like to hold myself to.
So have there been any struggles in your CPD or dental journey so far that some of our viewers might not have known about?
Yeah, probably. When I first bought my practice, I bought the practice and there was a long settlement. And that was fine. And in that time, the dentist continued to work and called up all the patients and saw all the patients, and that's cool. But then when I first transitioned, the global financial crisis hit. So a lot of the patients just weren't coming to the dentist. It was a bit of a struggle. So, and at that point in time, I was well into my LVI journey. So I was doing a lot of neuromuscular dentistry. So I was doing less implants because people weren't coming for that sort of stuff. And I was attracting a lot of pain patients through TMD type things. And I was doing a lot of neuromuscular dentistry. But a lot of those patients come to you with that sack of troubles and woes. And they don't want to get better. They just want someone that's going to listen to their story, right? And it wanes on you, right? And after about, I think it might have been 2 or 3 years of that, I went, that's it. I can't do this anymore. No, I burnt out. I really burnt out. And I think the final straw was I took a patient over to LVI, and we were doing some modifications with the patient. I'd been working on this patient for about 2 years. I'd got the patient pretty happy. Someone adjusted something somewhere, and they lost the bite, and the patient reverted back to where we were. And I didn't have the energy or the strength to do it all over again. So at that point I went, I've burnt out and I don't want to go back to work anymore. So I spent a bit of time not going into work. And then I had this, moment that alcoholics often refer to as a moment of clarity. And I said, well, I'm just going to go on sabbatical here. I'm just going to say, that's it. I'm not doing any more neuromuscular from this second onwards. And I'm only going to focus on the things that I want to do and the things that make me happy. So I'm just going to focus on implants because that's the thing I like most. And that is when my practice changed. It's when my, how much I enjoy working changed. My education things started to take off. And from there, I've been happy. And the second biggest thing for me was when I had the realization, my nurse at the time said to me, I was getting down because I started seeing other people doing all sorts of, wonderful treatment. And I didn't feel I was quite at that level. And I was worried about what they're doing and what he's doing and what she's doing. And she said to me, why don't you just run your own race and don't worry about what anybody else is doing. And the moment I no longer gave a shit about what anybody else was doing, and I just focused on myself, my internal happiness changed and who I am as a clinician changed. And they're the 2 points in my career that have given me the most joy and have changed my trajectory the most.
Wow. And that came from your nurse, did you say? Or
my nurse was a little bit older than me, but we had a really good connection. And yeah, that came from her. That she's a very, very intuitive people person. Right. So yeah. Those of you that are doing Straumann will know Kim. Kim was my nurse for almost 8 years. And she came from her.
Wow. It's you talk about financial crisis at that time and all that struggles. For a lot of the new owners, probably now at this time, they're probably going through something very similar, would you say? Or
look, there was a time where we came about 48 hours away from closing our doors permanently. Wow. And it was a very, very, very trying time for my wife and myself. And I don't envy anyone that is going through the same situation. I know what you're going through. My wife probably knows more than me because she's the brains and I'm the brawn. But you got to speak to people that are just more business savvy. Speak to people that are just business savvy and have a business mind. I don't have that queen bee work. I'm the drone. I'm the worker. I can do nice implants and I can focus on doing nice grafts, and I really get off on that stuff. But I need to get my business head on. But that's something that I feel is the one thing outside of clinical that I really need to focus on. And if anyone is listening to this and you are going to, or you want to be a business owner, definitely match business education with clinical education, because you could have all the great clinical skills in the world, but you are no good to no one if your doors are closed.
Right. And so did that instance catapult you into going into learning more about business?
No, I was just stupid and put myself more into clinical work.
Yeah. You double down more on the clinical side of things.
I did. I doubled down more into clinical, and I thought, well, if I just learn this, and this procedure, then everything will be great. No, dumb. But I've got a fantastic wife, and she carries me. So that's she keeps the business going. She's a numbers girl.
Well, they say behind every man, a strong man is a strong woman, isn't there?
Is she listening?
So, finding the right practice early on and finding the right mentor is difficult.
It is difficult.
How would you say that to a new grad who is, coming out, or a recent grad that's trying to find that right practice, that right mentor?
Without being a dick, shop around, right? Interview them as much as they're interviewing you, but don't go around like, I want this and I want that. Don't do that. Just go there and say, like, what sort of services you're offering. I understand that I'm a new graduate. Are you okay if I look over your shoulder? Are you happy to teach me this and you're happy to teach me that? And if it's not working, don't hang in there thinking that it's going to get better. If it's not serving you, leave or move on. Now, I know when I first graduated, that was way easier because there were jobs all over the place, right? I was working 3 jobs when I first graduated, and then I could go to, I whittled that down to 2, and then I bought my own practice. But, if I quit, I could find a job somewhere else pretty quickly, and they were decent jobs. But now I think we're just graduating so many people now that unless you're happy to go regional, you're going to have a hard slog.
Being open-minded and, always being open to being challenged is something I've heard. You were, what's your thoughts on that? Because I heard that at one point, were you closed-minded to PET when it kind of initially came about?
No, I grabbed PET from the start. I thought that was great. I was a little bit hesitant to jump in straight away, but I grabbed it from the start. I loved it. I thought it was really cool from the start. I really think don't close your mind off to stuff. Just listen to stuff and then bring it in. I would definitely say the biggest issue is don't try and do everything, and don't try and have a bit of a reasonable understanding of stuff. Just because you see it on Instagram and things look easy, or just because you saw a YouTube video, does not mean that they haven't left out critical steps between success and failure. But being challenged, yeah, I think you need to challenge yourself. If you are doing, well, that's what, for me, I need to be challenged. I need to, I'm always doing some sort of course. I'm always doing some sort of exam or some board exam or something. I'll always be doing something, right? For me, I like that challenge. As much as I sometimes wonder, why the hell am I doing this? It's of no benefit. And in fact, one of my mentors said to me recently, he said, are you doing this for money, or are you doing this for, is it going to get you a teaching position, or is it just, are you doing it for education, or are you doing it for ego? And it's a good question. Is this thing actually going to get you somewhere? Is doing that course or doing that, specialty or whatever, is it for, that you really want to do that work, or is it just for ego? And, be really honest, a lot of the times it's for ego, right? It is having another plaque on the wall or another medal or something else. I don't know, right? But I do like to challenge myself constantly. I do like to have exams, and I think that keeps you sharp. It keeps you on the fringe of things, on the leading edge.
Fair enough. So what's your ideal clinical or non-clinical day look like in 5 years' time, and what kind of CPD are you trying to dabble in or interested in?
Okay, so CPD, I would, at this point in my career, with where my hand skills are and what I think that I know, I would like to do more soft tissue stuff, like more refined, really high-end periodontal work. I enjoy that. I find that challenging, and it's something that I was scared of for a little while. And more complex bone grafting stuff, more vertical, predictable vertical stuff. I like that, right? What does my ideal clinical day look like? I love grafting. So if I could have a couple of big grafts in the morning and the afternoon is just singles with a transcrestal sinus lift, that is one of my favorite procedures of all. I love a lateral sinus lift in the morning, and I love a number of just posterior maxillary implants with a sinus bump. Definitely one of my favorite things. My non-clinical day, if it's work, I love teaching. I love running courses. I love running the theory stuff. I really like to get in amongst the students and have a laugh and teach. And on a non-clinical day, look, if I can, happy just to go for a drive or cruise around or go to a cafe and chat with some friends and have a laugh. I don't know, whatever. I'm pretty easy. I'm pretty happy-go-lucky.
That's nice. So are these courses in Australia in particular, or are they overseas?
They are, at the moment, they are all in Australia. The hands-on live patients is in the Central Coast. The theory ones with the models and stuff like that is all run in Sydney. When the borders open, some of the more advanced live patient stuff will be moving to Vanuatu and other places around the world.
But I'm talking about the courses that you're interested in, those grafting
the courses
ones.
the majority of the courses that I do are in Europe or the United States. Unless somebody really special is coming to Australia, I generally plus I love getting on a plane. I love getting on a plane. There is nothing better than just turning your phone off and just watching a movie or doing whatever. As long as you're up the front. If you're up the back, it's not so great.
Fair enough. So implantologist is now like a specialty over in the US, I hear. If that's ever happened here, would you ever consider specializing, or would you want to remain a super GP?
That is a great question. It's a double-edged sword. It's like endo, right? No one sends a single central, right, that has not had root canal before to the endodontist. It doesn't happen. Your general dentist does that. Same as a single crown or a single bridge. Very rarely does that go to the pros, right? So if you specialize as an implantologist, you're just going to get the stuff that's gone wrong or something that's just ended up in a really, really bad position that you need to fix or try and resurrect, or you're just going to squeeze something into someplace that you don't want to be in that sort of situation. Or you're also stuck just doing the same thing day in, day out. I don't mind a molar root canal. I don't think I'm an endodontist, and I don't mind punting them away. But if they're good, I don't mind doing it. I think a little variety is the spice of life. So I think one of the courses I'd like to get to is that one by Barat and Johan. I want to do that composite course. I think that's great. I would like to do that just for my occlusal access holes. I want to make them look as natural as possible.
You want to come back to the composite?
Yeah.
Is it?
I want that little orifice plug for the screw hole. I want to make that look as natural as possible.
Fair enough. So you're saying you would rather remain as the super GP, hey?
I don't know. I think that because
you're passionate in what you do.
It depends
on
how much my ego gets a hold of me, I guess. I think if you did the specialty, it would be good, but you would be challenged on the daily all the time. And it would be, you'd really have to work hard for it. Whereas if, you can fill your days with other things that just give you a little bit of spice or a little bit of something different and keep your mind clear, then there's that as well. So it's a hard question.
Yeah. Well, I mean,
chances are I would do it.
You do?
Probably something else to hang on my wall.
Well, I mean, if your kids were all grown up, would that change anything?
If my kids were all grown up and I could do anything, I would go. If I had to, you asked me before if I could do anything differently, what would I do? If I could do anything differently back at the start when I graduated, I would pack my shit and I'd be over in the United States and I'd do a double specialty, perio-pros.
That's the thing over there. They do double specialties.
That would be my jam, perio-pros.
Fair enough. Maybe something we'll have to consider for the Australian
one day. Look, if I could go, once my kids leave home and stuff, which is a good, 12, 13 years from now as a minimum, would I still be wanting to specialize? Would they take me? Maybe. If they did, sure. If not, I'll find something else to boost my ego.
So the trend for graduates at the moment seems to be working at multiple practices. You know, you mentioned that already. So in fact, I'm seeing more and more of that becoming the case. As someone who's worked across at least maybe 12 different practices, how would you describe that experience?
Do you know what? I think that if you're at one practice with one principle, you learn one thing and you learn one way of doing things and you learn one dental operating system, right? And you get into that groove. If you're working across multiple practices, you see how multiple principles work. You see how multiple principles deal with hard patients. You see how multiple principles and other clinicians, for that fact, interact with each other, with their nurses, with how they do things, what they're exposed to, what they all come with their CPD baggage and everything else as well. So I think working between 2 or 3 practices at any one time is fantastic. The only thing is the pain in the ass carrying your loops around everywhere.
Yeah, all your photography stuff.
That was well, when I was a graduate and before I bought my practice, there was no such thing as photography. That was just no one did that. When I first saw Otto Zuhr's photos, I was like, what is this? Nobody had done that before. So it was just carrying your loops. And it was a pain for me to carry loops between 2 practices. So I just bought 2 pairs. It just works in with my laziness.
Yes, fair enough. I actually carry a little toolkit and a backpack, and everyone asks me, are you still going to school?
Right.
So, if for someone like yourself who also works at multiple practices, but you still have one central location, is that right?
Well, I work at my practice at least 3 to 4 days a week. And then I'm off doing mobile stuff 1 to 2 days a week. No weekends, and nobody got time for that. Look, I think that this trend is potentially dying because like I said before, so many young graduates are coming out doing whizzies, doing full arch restorations, doing free gingival grafts, doing, connective tissue grafts, doing implants, doing full arch implants, all on 4s, XYZ. These guys are on a different trajectory. They're not going to be someone that shies away and wants someone to come in and take out a couple, shuck a couple of whizzies. It's not going to happen. They're going to be super GPs in their own right. And maybe they'll send to someone for zygomas or, complex endo. But I see these guys really becoming the super GPs. And unfortunately to say, I think the only specialty that will really survive will be endo, because nobody wants to do, molar retreats unless it's with a 2mm twist drill.
Yeah, fair enough. Yeah, I guess it's tricky. I mean, then it comes to the dilemma for the new grad is to decide to see that and then try to rush and try to learn all that things. That's a constant internal battle, isn't it?
Well, not really. I think, what Johan and David did was really good. They both have their interests. Johan's got the cosmetic side of things. I think he's doing Invisalign, stuff like that. David Zhang's doing the implants and the surgery side of stuff. I think that is a great match where you got 2 dentists in a partnership that have got different passions and different focuses that are complementary, and not one person is chasing the same thing. You have 2 dentists in a partnership that are both chasing the same thing. They both want to do implants, or they both want to do grafting. They both want to do wisdom teeth. They're both fighting for the same thing. That's never going to work. So I think what you'll find is that the trend will be a lot more younger dentists are going to get together and band together doing whatever. You might have a group of 3, 4, 5 dentists where they each have their own passion. One's got a passion for endo, one's got a passion for surgery, one's got a passion for ortho, and they'll just band together and they'll have their own little super GP super practice.
Fair enough. We got one quick question, which is
Go for it.
Is the Straumann grafting material xenograft or allograft?
Which one?
There was apparently the Straumann grafting material that
Straumann has a number of grafting materials, right? So the Straumann Cerebone is a xenograft, whereas that Straumann's bone ceramic is a synthetic, it's an alloplast.
Fair enough. That was just a random question that we got.
It's all cool.
So, Dr. Dean Licenblat, thank you for coming on the show today. If you let the people know how they can reach out to you or kind of what's going on in your life.
You can reach out to me. You can find me. You can call me at my practice. You can send me an email. My email is dlicenblat@gmail.com. You can find me on Instagram at dr.deanlicenblat. You can find me on Facebook. You can find me on OnlyFans. You can find me anywhere, whatever you like. I'm happy to take your calls.
OnlyFans.
The premium, it's worth it, I promise.
Well, have a good night.
All right. Thank you so much. It was great chatting to you.
Thank you.